From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Monday, January 11th. I'm Renee Chu. Before we get into the latest stories, we want to ask a favor. We're trying to get a better understanding of what you, our listeners, want to hear in this podcast. We have a survey that takes about 5 minutes to fill out, and we would really appreciate it if you would fill that out. You can find it at wrl.com/coronapod. Again, that's wrl.com/coronapod. Thank you so much. Now to the latest news. A local doctor responds to a social media post offering advice for people diagnosed with COVID-19. Last November, the author of this social media post was hospitalized with severe COVID-19 symptoms. They went home with these two prescriptions.
I have concerns both about azithromycin and steroids.
Dr. Eric Bolin with ECU's Vidant Health says drugs meant for one patient are not necessarily good for all. Azithromycin fights bacterial infections, but it can also affect the heart. Dexamethasone is a steroid, a potential problem early in the course of COVID.
Utilization of steroids without another indication actually can lead to poor outcomes.
Dr. Bolin agrees with resting belly down, also called proning, for better circulation and breathing. Physical activity also gets a thumbs up.
That's just the big one, and I'm really glad that was in the post.
The author also pitches dietary advice, including lots of vitamins.
I think attempting to get some of those same properties with food is probably a better idea.
For other advice on posts like this one, Dr. Bolin says, consider the source.
These are one individual's experiences, and that's all they are.
Dr. Bolin also advises if you're diagnosed with COVID-19, speak to your doctor, but remain isolated at home if you can. Monitoring devices in the home, like a thermometer, blood pressure cuff, and a pulse oximeter to measure oxygen levels, are all useful. More options are now available for senior citizens 75 and older seeking a COVID-19 vaccine, but supply is still limited. WakeMed, Duke Health, and UNC Health are all offering the vaccine to seniors who fall in Group 1 of Phase B in North Carolina's distribution plan by appointment only. Each hospital will offer appointments through their respective online portals to those who qualify. For the North Carolina Coronavirus Podcast News Brief, I'm Renee Chu.